Hey guys, so my topic is about the effectiveness of Kinesiotape. So I'm pretty sure you guys seen this colorful tape while watching Olympics or your favorite sports such as basketball or tennis, as you can see in the picture right here. So what's Kinesiotape? It was developed in 1970 by chiropractor Dr. Kenso Case with the intent to facilitate natural healing process of injured tissues. Now it's used to treat pain, muscular dysfunction, scar management, edema reduction, and also provide support and stability to muscle and joints without restriction of range of motion. Now let's compare the athletic tape versus kinesio tape. So you can see on your left side, the traditional tape usually comes with white. It's very thick, it's non-elastic, and retains moisture, which can cause skin irritation. Compared to Kinesio tape, which offer 12 color, and you can buy it pre-cut, it's very thin, elastic, and porous material that's similar to skin that removes moisture whenever you go swimming or just come out of the shower, or even sweating. So now let's talk about the different types of cuts and its purposes. So the fan strip and the web strip both enhance lymphatic drainage to reduce edema. The eye strip is commonly used by athletes for muscle facilitation or inhibition. The X strip often used when crossing joints to facilitate muscle contraction, such as knees, shoulder joints, and in the hamstring. The Y strip often used in sensitive areas such as elbow or behind the knees. So one study that I found is about kinesiotaping in lateral epicondylitis or tennis elbow. So the study had looked into 30 women with lateral epicondylitis and myofascial trigger point in forearm muscle were randomly assigned to receive kinesiotaping with tension and the placebo group without tension. The treatment was provided 3 times in 1 week, and the outcome measures were assessed pre and post treatment. The results have shown improvement in the pain intensity and upper extremity disability in the subject with lateral and myofascial trigger point in forearm muscle with kinesiotape with tension and was more effective than the placebo group. I believe the study will even be better if they have more participants and they do it for more than 1 week so that it will be more significant because there are other factors that might contribute in long term, and I don't think 1 week is enough to really say that it's effective. Here are two pictures on how to apply the Kinesiotape for people with tennis elbow. Then also I'll show you a video right now. So another study that I found very interesting is about Kinesiotape in scar management. So there are 54 participants, most of them are children, ages 2 to 18 years old, with hypertrophic scar, keloid, and contracture scars. The results have shown that more than half of them declare that using Kinesiotape had improved their scar cosmetically, and some of them also go above beyond 3 weeks and like up to 12 weeks, as you can see, and they still reported that their scar improved drastically. So the study concluded that using Kinesiotape is effective when it comes to scar management. So I saw these two pictures online. I thought it was so interesting. On the right side, that's pretty much how they will use the Kinesiotape when putting the skin together so that when it heals, it doesn't show the scar too obvious. And on the other side, it's so interesting the progression using the Kinesiotape. And in the end, you can see the skin looks like it's normal. That's amazing. I'll show you guys a quick video again about how they apply kinesiotaping. How cool was that? So the last thing that I'm going to talk about is kinesiotape in acute pediatric rehab settings. They look into 15 children with acquired disability, which include encephalitis, brain tumor, cerebral vascular accident, traumatic brain injury, and spinal cord injury. And they use an assessment looking into the function of their upper limb, and the result have shown a improvement when it comes to controlling and how they can use their upper limb in a functional application. I think this study is so interesting to look at because you can see in the picture right here, children probably won't have issue using this compared to a splint that might be too hard, too difficult to mold. Overall, I think Kinesiotape is a great intervention idea. It's cheap, it's easy to apply, and easy to manipulate. However, there's not much enough research out there to determine whether it's really effective or not. So I think with the help of future study, then OT can use it in the future or other professional out there. I did not find any psychometric data about kinesiotape. Also, I'm not sure whether it's covered by insurance or not. For future study suggestion, like I mentioned before, adding more participant will be better. And then also having more pediatric studies, because I only found two of them. Lastly, I think adding more studies about different disabilities will be helpful. I want to know whether it's effective for people with tremor or maybe some sort of like uncontrollable muscle movement. I think that would be a great idea. Here are my questions and my reference. Thank you.